Good evening, everyone, and welcome. My name is Kyla Hannington, and I'm the Public Outreach and Engagement Division Manager with the Prince George's County Office of Human Rights, the county's civil and human rights education and enforcement agency. Thank you for joining us this evening, and for those of you watching on demand later, thank you for checking out our work. We hope it is helpful to you. For the last several years, our office has partnered with the Prince George's County Memorial Library System for numerous events, including this series, Does Your Zip Code Impact Your Whole Life? We have held events looking at this issue, how your zip code impacts your life, from your opportunities for housing, for financial lending, for employment, your health outcomes, and have been so fortunate in the experts who have joined us. Dr. Alvin Thornton, former chair of the Board of Education, leader of the Thornton Commission that looked at the state of education in Maryland, and professor, talked to us about education. We have had real estate and banking professionals, and we've been extremely fortunate to have had so many brilliant healthcare leaders spend time with us. Dr. George Askew, the former Deputy Chief Administrative Officer for Health and Human Services with Prince George's County, joined us, as did Dr. Carter, the county's Chief Health Officer. We've had representatives from the University of Maryland Medical System, from Prince George's County's Health Connect, from Johns Hopkins. And because of their time and expertise, we've been able to look at this issue, the impact of where you live that has on your life, on your health, through many different lenses. We are so grateful to all the guests who have joined us, and we're very excited to welcome those with us tonight as we look at the social determinants of health. Tonight, we're going to hear from 5 guests who I will introduce one at a time. And after they've each presented, we will come together for a roundtable discussion and to take any questions that you have. This should be a wonderful, wonderful conversation, and I'm glad you are all here for it, guest panelists and viewers alike. Our first guest is Dr. Sammi Areola, PhD, and he is the Deputy Chief Administrative Officer for Prince George's County Government. He is also the acting health officer for the county. Until recently, he was the director of the Department of Health and Environment in Johnson County, Kansas, where he led the response to mitigate the impacts of COVID-19 on the residents of that county. Prior to that, he served as interim director of health and the deputy director for the Metro Public Health Department in Nashville, Tennessee. Sammi is a public health generalist who has been involved in aspects of health in all policies, health equity, social determinants of health, public health risk assessments, air toxic assessments, vehicle emissions, air pollution, indoor air quality, pest management, insecticide use and mosquito control, community water fluoridation, and concerns about household chemicals. He is passionate about community involvement in every aspect of public health decision-making, investigations, and interventions, and the need to incorporate principles of health in all policies. He is the former director of the Bureau of Environmental Public Health and a past president of the African Society for Toxicological Sciences, which organizes scientific conferences on environmental health and toxicological issues impacting the African continent around the world, and has partnered with major international agencies to address global health issues. He spearheaded the formation of Toxicologists of African Origin Special Interest Group as part of the U.S. Society of Toxicology. The Toxicologists of African Origin focuses on addressing issues impacting communities here in the United States and in Africa. Dr. Areola taught environmental health and industrial hygiene classes at Meharry Medical College for several years, conducts public health community engagement activities, and has been featured in several media addressing public health issues of concerns in the community. He has served as an expert witness on public health issues before elected officials and in local courts. He received his Bachelor of Science degree in 1988 and his PhD in environmental toxicology from Texas Southern University in 1998. He was a postdoctoral fellow with the Neuroscience Division, Baylor College of Medicine in Houston from 1998 to 2002. And it's an absolute pleasure to have you with us tonight. Thank you so much for joining us.
Thank you, Kyla, for the nice introduction. Good evening, everybody. Glad to be with you and glad to have the opportunity to talk about what I think is a very, very important part of health. I have been working in local health department now for 22 years, and this message, I think, has never failed in terms of us communicating the things that are important for us to deal with if we want a healthier community. Look, health is broad. We must understand that. We must intentionally define it as such, and we must intentionally create solutions based on those understanding. How we plan our cities, how we build our roads, how we build and plan our schools, even how we run our prisons, all of those impact health. Social variables. Whether if you want me, for example, to be active, you've got to make those healthy options easier for me in the community. If you want me to be active, make sure that I have sidewalks that are easier to navigate and to walk. Make sure that when I step out of my home, that I am not afraid of dogs running at large or afraid of being shot or afraid of being policed differently because of what I'm wearing, because I'm wearing a hoodie or what I look like. Those are social variables. If I live in a community that's poor, the sidewalks are likely to be poor, the roads are likely to be poor, housing are likely to be inadequate and poor. All of those factors impact health. As a matter of fact, one of the things that I tell people all the time, a very good indicator of health is to take a look back at investment in communities, zip codes in the last 10, 20, 30 years. And it's very easy to see when we overlay community zip codes with health metrics, health outcome data, how they easily overlay social variables, how they easily overlay economic variables, how they easily overlay political variables, the so-called social determinants of health, economic determinants of health, and political determinants of health. And those are very important. That's why when we talk about your zip code, it's a bigger, a stronger determinant of your health than your genetic code. It's because all those factors are very important to health. Here's what we have done in the US for decades. We have focused on specific health metrics. We have focused on controlling obesity. We are focused on controlling diabetes. We have focused on controlling the cardiovascular illnesses and other factors. In reality, we know the factors that are more likely to contribute to high incidences of these conditions. And so when we take that approach of focusing on specific endpoints, it's really similar to I've got a water leak. What I'm doing is looking for rags and towels and mopping the water. Well, if we focus on social determinants of health, we focus on understanding that if I'm poor, typically my health is poor. If I have inadequate housing, if I don't have access to good food, healthy food, I'm not likely to be healthy. If I don't have access to preventive care, that's going to impact my health. If we go upstream to look at those factors, we will be plugging the leak, fixing the leak rather than mopping the water. And that tends to be more effective. As a matter of fact, a lot of those health outcomes that we look at all have commonalities when we go upstream and address them at the higher level where our actions may be more impactful. Give you an example. The CDC, Centers for Disease Control and Prevention, a few years ago did studies. They call it High Five, HI-5, health impact in 5 years. And they look at several metrics, including the earned income credit, where additional $2,000, $3,000 to a family significantly produced measurable improvements in health. So again, we have known for a long time that people on the lower end of the socioeconomic scale tends to have poorer health outcome. So it's not a stretch. So we have so many examples. The United States, we spend about $4 trillion on healthcare. That's almost double the average of other OECD countries. However, in many cases, we rank sometimes at the very near bottom in terms of health status when we're compared to other OECD countries. The difference, though, is those other OECD countries they spend a lot more on these so-called social economic determinants of health, these upstream factors. When people have issues with housing or unemployment, they look at them more like, how can we help you? What happened to you? In the United States, we haven't gotten that message yet. It's almost like we're saying, what is wrong with you? Until we begin to invest in those public health, those upstream factors, we will not see the improvement in health that we need to see. The last few years, we are beginning to see drops in our life expectancies in the United States. And so, again, just to be clear, you do have quite a few healthcare individuals, experts here, and that's great. I am a public health person, and I always say that healthcare is very important. We have the best healthcare in the world. That's a great thing. Now, here's public health. Public health is everything that happens to you, everything that you need to do before you need to seek healthcare. We need to invest in those also. We need to invest in preventive care. We need to ensure that people have access to adequate housing. We need to ensure that people have access to adequate healthful food. We need to address gaps, food deserts, and those things. If it's tough when we send kids to school and we talk about their performance. When a kid is not even sure where the next meal is coming from, how are they going to learn? The pandemic is a good example. We took these kids of their homes in 2020. We put them out of school. We put them in their homes. They came out of their homes in worse condition, not just mentally but physically. We have an explosion of mental health. Again, mental health is public health. The way we define health is not just the absence of infirmities or physical ailment; it's a state of complete physical, mental, social well-being. And so again, the home environment, if we do our jobs right, our job is to create conditions in every part of the country, every part of the state, every part of the country, where everyone, no matter what they look like, no matter what their age is, no matter what their sexual orientation is, where everyone has the opportunity to be as healthy as they can. That's got to be our goal. The only way to do that is not a focus on mopping the lake, it's a focus on these social, economic factors that determine health. In 2020, 2021, we infused a lot of resources into family economic benefits. There's a lot of income stabilization models that we've seen across the country. On paper, people say it will make people lazy, but we see measurable improvement in health of residents when they don't have to worry about paying their rents, when they don't have to worry about where the next food is coming from. They actually tend to look for opportunities to be gainfully employed. Their mental health is better. And so again, that's what we mean by a focus on social determinants of health. If we do that well, with the very, very good healthcare system that we have in America, our health will be a lot better. Thank you for the opportunity to speak to you. I'm sure we'll talk about a few things more, and I look forward to answering the questions that you may have. Carla?
Well, thank you so much. That was wonderful. I already have about 5 questions just from your presentation. It was absolutely wonderful to have you, and we'll bring you back at the end when we have our roundtable discussion. So our next speaker is Robert Jepson, who serves as the Chief Operating Officer at White Oak Medical Center, which is a 200-bed acute care hospital located in Silver Spring, Maryland, along the Prince George's County border. In August of 2019, the hospital moved from Tacoma Park to its current location off of Cherry Hill Road. White Oak Medical Center is part of Gaithersburg-based Adventist Healthcare, a regional healthcare provider of hospitals, outpatient clinics, physician practices, and wellness programs. Robert has worked in various roles with Adventist Healthcare for more than 30 years, including communications, government relations, business development, regulatory affairs, and hospital operations. He led the effort for community support and regulatory approval to relocate the former Washington Adventist Hospital from a small, inaccessible, aging building and medical campus to a modern medical facility in Silver Spring. He also secured legislative approval to develop a freestanding emergency department and worked to secure approval for a comprehensive freestanding rehabilitation hospital serving patients from Prince George's County and Montgomery County. He has served in his current role as COO at White Oak Medical Center for nearly 3 years and has executive responsibility for daily hospital operations. Robert graduated with a BA in journalism from Andrews University in Michigan and has a master's in healthcare administration from Mount St. Mary's University. A native of the DMV, Robert was born at Washington Adventist Hospital in Tacoma Park, the same hospital where he works today, and has spent most of his life in Maryland. Robert is married to Idalis. I'm sorry, I should have asked you. How do you say your
Idalis.
wife's name?
Yeah, Idalis.
Idalis
Yeah.
Jepson, and has 2 grown children, both of whom work in healthcare. It's wonderful to have you with us. And until doing this, I wouldn't have realized that White Oak Medical Center is quite so challenging to say. Thank you so much for being with us.
Well, thank you, Kyla, and greetings to my friends and colleagues in Prince George's County. It's really an honor to be here. I'm very proud to be a son of the DMV. I grew up in my early formative years in Tacoma Park, Maryland. Spent much of my time in Prince George's County and much of my time in Montgomery County. So I lived the first 13 years of my life right on the border. And as Kayla indicated, I was born at Washington Adventist Hospital. So I literally and figuratively, I haven't gotten very far in life. The intro was helpful. Just want to make a couple of comments in addition to that. And I know some of my colleagues in healthcare will speak about this as well. We're in a really interesting time for healthcare. Healthcare is always challenging. It's really challenging now. We are still in literally and figuratively a recovery phase from the COVID pandemic, which is a historic pandemic that we've all lived through. And it has had a massive impact on healthcare facilities, hospitals, nursing homes, other healthcare facilities. And we're still very much feeling the effects of that. It was just last week that our hospital went to mask optional, except in procedure areas. And so we've been masked for 3 years. And in fact, and this is, to say this in all seriousness, there's many people that I'm meeting in the hallway, and it's the first time I've seen them without a mask. We've seen a great disruption in the healthcare resource, the staffing market for whether it's nurses, techs, physicians, and others. That is finally starting to stabilize. But for 3 years, it has been a major disruptor in terms of, and every hospital has felt this in terms of staffing levels, the cost of staffing, medical supplies, and so forth. So the good news is that, as I said, we're starting to stabilize a little bit. Things are becoming more predictable in terms of staffing levels, in terms of costs. But everyone who has been a part of a hospital, part of a nursing home, part of a home health agency, part of a physician's office really has faced major challenges. And in my eyes, anyone who was part of healthcare over the past 3 years in any way, whether on the front lines or not, is truly a hero. So I think the future's bright. I think we're blessed in Maryland, in the DMV, to have very strong healthcare providers. We have about 43 or so hospitals. But I think the future's bright for healthcare and hospitals in Maryland. The subject of tonight's program is, does your zip code impact your whole life? Does your zip code impact your whole life? The answer to that question is yes and no. We do know that zip code, where you live, is the greatest predictor of how long you are expected to live. So it's more significant than race. It's more significant than genetics. It's more significant than gender. It's more significant than your cholesterol level. It is the single largest predictor, the single greatest predictor of health. So will it impact your whole life? The answer is yes, if you are in a community that is facing challenges with some of the social determinants of health that Dr. Areola spoke of. If one moves or changes certain aspects of their social conditions, then the answer would be no. But I think we have to be very clear about the fact that there is absolutely no question that where you live, the zip code you live in, the conditions of that zip code and the conditions of your home life and your neighborhood very much impact your health. And I'd just like to read a few things from a literature search, and I won't take long to read each of these, but I do want to, for clarity's sake, just to read them. Zip code, as we said, is the greatest predictor of how long you are expected to live. Again, as we said before, it's not your blood pressure, it's not your cholesterol, it's not your genetics, it's your zip code. Something else from the literature. This is from Tulane University, speaking of the importance of zip code. 2 racial groups lived under circumstances in a study that was done by Dean Leviste in Baltimore, and they found that differences in health were much less between the racial groups when their living conditions were dissimilar. Dean Leviste and his colleagues concluded that from the study that when, quote, when social factors are equalized, racial disparities are minimized. They also say that differences in life expectancy often contribute to public health disparities, and it's often based on neighborhood. There is, and as this article goes on to point out, there is a history of injustice, a history of discrimination that is borne by certain racial groups, African Americans and others, more so than whites. That's absolutely clear. But what this article from Tulane is saying, it's place. It's not anything genetic. It's not anything biological. It is place. Furthermore, lack of access, some of the factors, the social determinants of health, and Dr. Areola talked about this, I think, quite articulately. Lack of access to quality education, lack of access to adequate housing or social support, exposure to crime and violence. Many of these are, all of them really are the result of systemic injustice. And all of those issues impact health status. One more thing, reading from Health Affairs magazine, is startling how strongly someone's health and longevity can be influenced by where he or she lives. Startling, that's an interesting word. A person's zip code is a stronger predictor of his or her overall health than other factors, including race and genetics. One of the things that the literature points out is that education is a major factor for improving health status, not just literacy, but education. In fact, one study has found that getting a college education, just that alone, adds 5 years to life expectancy. So the literature is clear in terms of answering the question for tonight with our group. Does your zip code impact your whole life? So it can, depending on where you live and how long you live in that location. I think one of the things that in my 30-year career in healthcare that I've experienced is that access to modern amenities, modern healthcare facilities has a significant impact on communities. We know that certain communities, whether it's barriers of distance, whether it's barriers, some other geographical barriers, or barriers of access, including transportation, that has a major impact on health status. One of the things that we have tried to focus, and I know other hospitals in the state of Maryland are doing this, and I'm sure my colleague and friend Yumi Shim will talk about her experience with Fort Washington Medical Center in this vein as well. But increasingly what we're seeing in healthcare is that hospitals no longer focus solely on healthcare within the walls of the hospital. Increasingly, hospitals are held accountable for what happens in the communities that they serve. And often that accountability comes in the form of quality scores. It comes in the form of how hospitals are reimbursed. There is accountability for things such as readmissions. There is accountability for how well we serve the community, certainly in the hospital. But increasingly, and I've seen this consistently in my career over the last 10 to 15 years, increasingly hospitals are spending more on resources that focus on preventing people from coming to the hospital, but also in their transition of care from the hospital to the community. In fact, we had a meeting this morning with our executive team. We were looking at issues such as length of stay and discharge planning, helping people get out of the hospital into the community to transition effectively And often that means, and we were talking about that this morning, helping people pay a water bill, helping people find adequate housing, how people can have access to not just food, but healthy food. One of the things that Adventist Healthcare does is it has a community impact fund that focuses on some of these social determinants of health. And often what we do is review applications for after school activities for kids who may not have a stable home life. We focus on healthy cooking education. We focus on access to food and food banks. We focus on sometimes issues such as access to primary care. We fund organizations that provide a medical home and access to primary care. So as we spin out of this hyper focus on COVID, we're really returning to a dynamic that has been in place in healthcare for the last 10 to 15 years. And that is focusing more and more on what happens outside of the hospital. And finally, I just want to conclude. I want to make sure I leave plenty of time for my colleagues, but I just want to highlight one fact that increasingly county or jurisdictional boundaries really have less and less to do with how people access healthcare, or it should not have an impact on how people access healthcare. White Oak Medical Center, which used to be located in Tacoma Park, is in Montgomery County. We're right along the border off of Cherry Hill Road. So technically, from a zip code perspective, we're a Montgomery County provider. But if you look at where our patients come from, more than 50% of our patients come from Prince George's County. And in fact, of the top 3 zip codes where our inpatients come from, 2 of the top 3 are from Prince George's County. They're Hyattsville, 20783 and 20782. It's primarily the Langley Park section of Hyattsville and Prince George's County. The average household income in those 2 zip codes is about $57,000. It's about $40,000 less than the statewide average. One of the things that we have focused on is access to maternity care for these women. The birth rate in our area is actually much higher than the national average. And so we have focused in a very intentional way on access to modern facilities, access to prenatal care, access to delivery services, and postpartum care for women in our community. So that's just one thing that we're doing. Many other hospitals are doing other similar things, but the needs of a community should and often do drive the types of services that healthcare providers make available. So with that, I'll stop. And thank you again very much, Kyla, and thank you, Prince George's County, for the opportunity to speak about an area that I love and have lived in most of my life. Thank you.
Thank you. Thank you so much for being with us. And Sam, I also have many questions for you. And I was really struck, and if we have time, I definitely want to talk more about the transition effectively and how hospitals are working with communities and providing support to erase some of those barriers or to try to beat some of those barriers. So that was fantastic. Thank you so much. We'll bring you back. We'll bring you back shortly. So next, I'm really excited to bring up Dr. Marissa Leslie. Dr. Leslie is Assistant Medical Director of Psychiatry for Adventist Healthcare. She is Assistant Professor of Clinical Psychiatry for Georgetown University of Medicine and Howard University School of Medicine. She is a trustee of 2 prominent boards, Adventist Healthcare Inc. and Devereux Advanced Behavioral Health. She specializes in treating depression and PTSD in children and adolescents with an academic interest in immigrant and refugee trauma. Dr. Leslie holds a Doctor of Medicine degree from Loma Linda University. She completed her residency in psychiatry at the Loma Linda University Medical Center and completed a fellowship in child and adolescent psychiatry at Children's Hospital of Philadelphia, University of Pennsylvania. She holds a certificate in refugee trauma from Harvard University. She's worked with youth in her personal life as a big sister and youth club instructor as well, and believes in the ability of every child to thrive and succeed with proper support and mentorship. She has been invited to speak and present to multiple conferences, podcasts, and television interviews, and this aligns with her goal of educating people on the importance of attending to their physical and mental health, since both aspects of health contribute to wholeness and true healing. In her free time, she enjoys traveling with her husband and daughter. Dr. Leslie, it's so nice to have you with us. Thank you very much for joining us.
Thank you, Kyla. It's such an honor to dialogue with Prince George's County. Please let me know if my sound is good. Okay,
It's
excellent.
great. It's great.
Okay, good. So I'm going to tell a little more of a personal story. My colleagues did an excellent job highlighting the statistics and the facts and the background to how zip codes affect your health. And I will emphasize zip codes and its effect on their effect on mental health. This past weekend, I had to take my daughter to enjoy some boba tea with one of her classmates. Her classmate is turning 11 today, actually. And so we went for boba with her classmate and her classmate's sister, and her grandmother was there. Her grandmother is from Bronx, New York, and I grew up in Queens, New York, in Jamaica, Queens, New York. So as the adults are talking, kids are drinking their boba, the grandmother says to me, I'm really trying hard to make sure the girls are always aware of their surroundings. They're growing up in the suburbs. I want to make sure that they're savvy, that they're not naive, that they won't be victims. And her very New York City philosophy resonated with me because my childhood zip code was 11435, Jamaica, Queens. And that's the exact same mindset that was instilled in me by choice, by my family's choice, but also by necessity. Jamaica, Queens at the time in the 80s was, it wasn't safe. It was a neglected neighborhood. At the same time, there was a lot of community, a lot of diversity, and a lot of interpersonal support. However, how did it affect mental health? Well, as a child, many children want to be able to play outside. They want to be able to maybe go over for sleepovers. None of that. I could have really none of that. Sometimes we were able to play outside, especially if illegally someone opened up the fire hydrant on a hot day and cooled the kids down, or there was shaved ice being served, and the ice cream man still came to our neighborhood. Neighborhoods that I think sometimes we talk of as other, but I'm honestly grateful that I had the experience of growing up in one of these zip codes that can negatively affect our physical and mental health. Not at the time. As a child, I could tell the difference. I could tell that when I visited my cousins in Boston or in California, they didn't encounter the same images I encountered. I knew from an early age what methadone was. I knew what someone addicted to heroin looked like who was on methadone. I knew that they slept on a park bench. They just kind of did the nod, their head kind of hit center, didn't fully hit their lap, and then just kind of jerked back. Now, as a young child, that's not what I want my daughter to have to see every day. But that's the reality of some of our zip codes. And quite honestly, some areas of Prince George's County. And I think Prince George's County is interesting in that there's that reality, but then there's so much wealth in Prince George's County, and there's so much specifically Black wealth in Prince George's County. So how does the Prince George's County zip code affect mental health? I think in some sections, it affects it really well. I think there's a sense of community, and my mother-in-law is a proud resident of Prince George's County. Her neighbors are lovely. There's a big sense of community and a big sense of pride in that, as my colleague Rob mentioned, getting that college education really has helped all of us, many of us who come from humble beginnings. But it doesn't completely solve everything, because we still navigate these zip codes and other zip codes with our skin and our accents. And according to public health professor Arlene Geronimus, we still encounter the trauma and the chronic stress of racism. We can't escape that. No amount of education or money shields us from that. And the stress from racism, according to Geronimus, she coins that term weathering. Weathering is the chronic stress due to racism and poverty. And that stress that stress of being in a marginalized group, such as a person of color or a woman or LGBTQ, it exposes us to suffer nearly constant stress and serious health problems. And what's interesting is that the zip codes affect mental health more than physical health. They certainly do affect physical health in terms of access to healthy food. Do you have walkable space? But what I described earlier, that mindset of, are you aware of your surroundings? What are you exposed to? How much violence are you exposed to? Is your family keeping you inside, as a child, adult, or a seasoned person of older age? Are you forced to stay inside because of the surroundings? That affects your mental health, clearly. And that chronic stress, as Rob mentioned, can lead to lower life expectancy. It's not all bad, though. My personal experience, like I mentioned, is that there were plenty of good times. There were plenty of laughs and solidarity, and I really never felt other. It wasn't like I was living in a very rich neighborhood and felt like I didn't fit in or I couldn't go on the same vacations. Many of my peers had similar experiences, and that sense of shared experience can be protective mentally. But I do think the first step is awareness, being aware of how your zip code affects your mental health, how it affects your physical health, and being a change agent and a voice so that there can be more equity. And so that even if you don't have the big house, the big yard, your zip code is a safe place, is a warm place, is a place you can think of fondly, and is a place that you want to raise your own children in. So I think Prince George's County has many strengths in that sense. I'm really honored to sit on this panel and to join in on the conversation. And I look forward and I commit in my own personal life to ensure that all zip codes have the same access to mental health care, to physical health care, and to just things that help you live a healthy and whole life. Thank you for inviting me today.
Thank you so much. Thank you so much. It was wonderful to hear from you. And I'm looking forward again to bring you back at the end for a group conversation. Our next speaker is Umi Shim, who is the president of Adventist Healthcare Fort Washington Medical Center. I'm just going to bring her up. Here we go. Umi has over 30 years of a unique blend of clinical, operational, and strategic experience with a track record of accomplishments in the areas of clinical innovation, strategic planning, business development, and operational management. She was born in South Korea, migrating to the United States in her late 20s, and pursuing her master's degree in nursing informatics from Columbia University in New York, while working as a staff and then nursing leader at New York Presbyterian Hospital. Umi has been a nursing and operations leader in acute care hospitals throughout the United States and worked both in not-for-profit as well as for-profit healthcare systems. She currently serves as the president, AHCFWMC, which is Adventist Healthcare Fort Washington Medical Center, and Ambulatory Networks, leading the company's growth strategy and expansion initiatives in southern Prince George's County. She also served as the Chief Strategy Officer for Adventist Healthcare, based in Gaithersburg, and the Chief Operating Officer of Shady Grove Medical Center, the flagship hospital of Adventist Healthcare located in Montgomery County, Maryland. She has 4 beautiful children with her husband and is a proud grandmother since her first grandchild was born in 2017. And President Shim, it's just an honor to have you here as well. This has been an extraordinary evening, and we're happy to hear from you. Thank you.
Thank you, Kyla, for your kind introduction. I hope you can hear me well.
Yep, you sound great. You sound great.
Good. I'm no expert of, such topic as social determinants of health. I realized as I listened to other presenters, but I can definitely share my own experience of what we discovered since we joined the Adventist Healthcare family. I have been with Adventist Healthcare for now about 12 years, but About 4 years ago, 3.5 years ago, when we were considering merging with the Fort Washington Medical Center, I was asked to come down here and serve as the president. And that was about 4 months prior to the pandemic, which was an interesting time. So we just joined Adventist Healthcare family, then started to understand as to what's going on in the area and what we need to do to help the community right before the pandemic. And when the pandemic came, we were all just focused on that. Couple of different things at the early stage of pandemic that we learned. One, community is really underserved when it comes to healthcare. So the state had called us and said, we believe your hospital is the most vulnerable hospital in the entire state in terms of surge capacity of COVID patients. And we would like to add you more beds. So they gave us about 46 beds, 16 ICU beds, and 30 medical surgical beds in temporary setting. And that was added to our 37 physical beds that we were operating under. Now, that's very small, especially when you consider we're serving about 330,000 patients in 10 zip codes around southwest side of the county. The county is close to about 1 million people, 330,000, about 33% of them. Pretty good size of population that we're serving. And we only had 37 beds to serve that population, which was woefully inadequate. And the state had realized that. So they overnight more than doubled our capacity. And then our journey started on. From there on, we decided to study the community. So we got the demographics data out of those 10 zip codes. We figured out people in those 10 zip codes are about 330,000 people. And a couple of other things kind of stood out. Number one, when you look at race and ethnicity mix, we're about 70 to 73% African Americans or Black, and another 20% other minorities. So we're truly majority minority, over 90% majority minority community. The second thing that stood out is income, median household income by 2020 census data was somewhere between 77,000 to about 159,000 per year. And it's a pretty broad range, but more of the populations were belonging to the higher income bracket than lower income bracket. And by that, you could say this is a pretty wealthy community. One zip code especially stood out to me because their median household income in 2020 was $157,000, but they were designated by AHRQ as the medically underserved area. So it gives you an idea of what needs to be done about that. And third thing that stood out is that we're bedroom community too. Community is pretty well insured. The uninsured rate is about 4%, better than national average. Over 60% commercially insured. So in any market, you would call us to be pretty desirable or wealthy community that could well afford healthcare. And then we found very uneven, unmatching things, which made me to question, I think the title of today's conversation is, does your zip code impact your whole life? And I started to ask a slightly different question of that question. It's a different version, but it goes something like, does a mistaken identity about your zip code impact your whole life, especially health? So I have some interesting healthcare outcomes data to show. If you can bring up the presentation, Carla. Okay, good. So this is showing us of Prince George's County. It's a color map of diabetes patients who are adults in the county. So darker blue means you are over 14%, which is pretty high concentration of patients. And I'm hoping you can see my arrow here. So we serve in this southwest corner of Prince George's County. As you can see, we have higher concentration of a number of adults with the diabetes. Now, if you look at us, through the lens of the state average to see, are we worse off or better off than the state? And the red color code means that we are at the bottom 25th percentile, bottom quartile of the state. So we do poorly when we compare ourselves to the state. And then if you look at us against the national average, again, our area has most red colors, meaning that we have more diabetic patients concentrated in southwest side of the county than the rest. This is an interesting information actually to take a look. So then I look to see how many endocrinologists do we have near us versus how many dialysis centers do we have. So endocrinologists, as you know, are those who can either diagnose you or manage your diabetes when you're diagnosed. So very important to work with diabetic population, and the more, the better. On this map, in this area, we got about 2 red dots because this is the area that we are serving here. And both of them are not full-time endocrinologists. They're less than half time serving our area. But on the right is number of dialysis centers. So when you have long-term unmanaged diabetes, it will affect several different organs. You eventually lose your eyesight. You can also lose your kidney, as well as you can lose your limb, because your blood circulation to your limbs are not going to be that great over time if your diabetes is unmanaged. So as you can see, we have total of about 8 centers serving us in the area. We don't have enough physicians to diagnose or prevent and manage diabetes, but we have plenty of service locations for chronic renal disease patients who need dialysis. So we don't do enough preventions, but we do plenty of care and service for those who are already losing or lost their kidneys. So it's an interesting thing to really think about. And I want to show you another slide here that talks about maternity health in the similar vein. So far left map here is showing by color where the babies are being born in Prince George's County. By the way, there's about 12,500 births happening in the county a year. And as you can see, Northern County has more colors, so they have more babies being born. The middle map here is showing where the low weight birth babies are born. And as you can see here, a lot more low weight birth babies are born in the Southern County. Now, why is that important? Low weight birth babies are an indication of lacking or underrepresented prenatal care. So, mothers have to make 10 plus visits to OBGYN physicians to get proper prenatal care. And if you didn't make it to all of them or didn't go to them at all, your likelihood of you having a low weight baby is pretty high. And when babies being born low weight, they also have much higher complications and mortality rates. So it is an important health indicator as to how healthy is the community. And as you can see, South County has a lot higher prevalence of low weight birth. And you may ask, so why is that? It's an important question to ask. And the last map on the right is showing why that is happening. Those green dots that you see are where the babies are being born from the county. Larger the green dot, more issues, more babies are being born in the area. So they have a lot more access from Northern County, although it's not in county. They have more resources outside of the county than inside of the county. But if you live in Southern County, you really don't have any access. So where you live is really affecting maternal health. And we have numerous examples like this happening in southwest side of the county, because the community has been, looked as pretty high diverse population down there. There's an assumption that they may not be able to afford the care. So that's what's going on. Anyway, I think I'm just going to stop here because I can share with you a lot more information, and it will probably generate a lot more questions. And we see where you live or how people perceive about what the area is because of demographic mix really makes a difference in the health outcome overall for the community. So it's something we're very mindful of. We're trying to address them very actively. And I'm so glad that I had an opportunity to share with you some of the information.
Thank you so much. Well, I can already see we're going to have you all back and go do even a deeper dive on our deep dive. And so I'm going to take you off screen for just a moment, President Shum, and then we'll bring everybody back up for just a few questions at the end that we can all have together. Thank you so much. Our last guest today is Dr. Ogechi Anyoku from the Adventist Medical Group in Fort Washington, Maryland. Ogechi Anyoku, MD, Master's of Public Health, Master of Science Public Health, is a board-certified internal medicine physician with Adventist Medical Group. She attended George Washington University, where she completed a Master of Science in Public Health in addition to medical school, and she then completed her internship and residency at MedStar Washington Hospital Center in Washington, D.C. She has a special interest in wellness, nutrition, and weight management. Her philosophy of medicine is individualized medicine that treats the whole person, body, mind, and spirit. It's very important to her to develop a partnership and relationship with her patients that is rooted in mutual respect to obtain the best health outcomes. Prior to joining Adventist Healthcare, Dr. Anyoku worked at Associate Physician Internal Medicine of Northern Virginia, where she assisted patients with managing chronic diseases. She has volunteered in the Washington, D.C. community and has also published in the Journal of Clinical Virology. Yes. She is part of the American College of Physicians and Internal Lyme and Associated Diseases Society. When Dr. Anyoku isn't seeing patients, she enjoys working out, spending time with her husband and children, learning how to create self-care products, and trying new foods and recipes. And we're so happy to have you with us. Thank you very much.
Thank you. Thank you so much for having me tonight. And thank you to all the speakers. You have really given us so much great insight onto how your zip code affects your life. So I have had the opportunity of living and working in several different areas in the DMV metropolitan area. As stated, I did my training in Washington, D.C., and then I moved on to working at an outpatient practice in Northern Virginia, and I'm now currently working in Fort Washington, Maryland with Adventist Healthcare. So training and working in Washington, D.C. was very challenging and unique experience. I worked in a large hospital system that mostly served patients that were of low income and low education level. I think if you kind of broadly separate the patients into young and old, you would see that the young patients were usually coming in for trauma issues or uncontrolled medical conditions. And then the older patients were coming in for decompensated chronic illnesses. On the outpatient side, very similar. I would see younger patients mostly for follow-up in trauma-related issues, and older patients for chronic medical conditions like high blood pressure, high cholesterol, and diabetes. So I just want to touch on 4 points when it comes to social determinants of health in these different areas that I've worked in. So I will talk about transportation, income, education, and food access. So starting with Washington, D.C., transportation was actually a huge issue, and that really impacted our patients and their ability to receive care. Several patients lived in areas where they had poor access to public transportation or private transportation. So as you can imagine, this just created missed opportunities for proper management of their medical conditions, and missed opportunities leads to poorer outcomes. When it comes to their education level, several of these patients were very poorly educated. They didn't even have a baseline idea of kind of what it is to have a medical condition and the importance of, treating those medical conditions with medications and being compliant with those medications. So again, we would see a lot of patients who were not very well controlled. And when that happens, there's a greater burden on the healthcare system because a lot of these patients are going into the emergency rooms when they're having issues with their conditions. And income, of course, is a huge determinant that can really impact whether a person is being able to manage their condition. If they do not have the income, they can't afford medications to treat their illnesses. And these are even medications that, we would think would be fairly cheap for bread and butter conditions like high blood pressure and diabetes. When a patient is concerned about whether or not they can pay for their rent, this is a huge issue because they're going to choose to pay for their rent and have a place to live as opposed to taking the medication that they so desperately need. So there was definitely that disconnect because that also pulls education and knowledge status into play there. And of course, food access is huge. We know, especially with these lifestyle diseases like high blood pressure, high cholesterol, diabetes, nutrition is so very important. And as you know, in Washington, D.C., there are several food deserts. We did serve an area that we were getting patients from Ward 7 and 8, and we know that those are food deserts and several other places in D.C. So these patients did not have access to grocery stores. Mostly what they had access to was fast food stores or fast food restaurants. And we know that these foods are loaded with salt, loaded with fat, loaded with sugar, which is definitely not what you want when you're trying to treat high blood pressure, diabetes, high cholesterol. So after some time, I did move to Northern Virginia where I worked, and it was a very big difference between the patient population and the outcomes of their health conditions. Now, I was seeing the same types of health conditions, high blood pressure, diabetes, high cholesterol, with some sprinkling of other chronic conditions in there, but there was a huge difference. When it comes to transportation, all of my patients had private transportation. I don't think that any one of my patients required public transportation, and therefore all patients came in to see me during their scheduled appointments. And if they could not, then they would call to reschedule ahead of time. When it comes to education level, most of my patients were very highly educated. They would even do research on their own about their own medical conditions, come in asking questions, come in taking notes, and they were able to implement what they were learning in the visit outside when they went home so that they had better control over their illnesses. And income, again, is so important. And most of these patients had steady incomes where they were able to afford the medications they needed and had very good control over their medical conditions. And food access was really not a concern. These are patients that are, now talking about whether or not they are going to get organic fruits and vegetables versus non-organic fruits or vegetables. So the access to the grocery stores was there, and the access to quality food was there as well. So now I'm currently working in Fort Washington, which is in Prince George County. Prince George County is actually the second largest county in Maryland, but it's not the second wealthiest county in Maryland. It's actually pretty far down the list. But what is actually surprising is Fort Washington itself actually has a higher median income than the rest of Prince George's County. So the type of patients I'm seeing now is actually quite a wide range, because we are seeing patients that come in from all over Prince George County, as well as patients that come in from DC as well. So again, still treating your bread and butter medical illnesses like high blood pressure and diabetes. But now when it comes to some of these social determinants of health, I'm seeing a wide range of people who have issues with transportation, but not significantly, right? So there are some people, I have a very small amount of patients who have issues with transportation, but actually most of them are able to come in, follow up with their appointments. And those who are missing appointments are actually missing because they are having trouble with getting off of work. So a very different type of situation that I'm experiencing right now. When it comes to income, most patients do have a degree of city income where they're able to pay for their prescriptions. But again, there's a handful of patients, which, I think is representative of the whole of PG County, that it's a wide range of income levels. And I'm seeing that as my patients are coming in. And when it comes to education status, again, very wide range. I'm seeing patients who have lower education levels and some who are very highly educated, master's degrees, doctoral degrees that are coming in as well. Again, representative of the wide range that we see in PG County. And then, of course, food access. Now, there are some areas of Fort Washington that are considered food deserts. Technically, where we live, we do have pretty good access, or where we work, we do have pretty good access to grocery stores. And you can see that improvements are being made with getting quality grocery stores in to serve the community. So I think it's very apparent that where you live can affect how your health status is and overall how your life is. I think it's important that we continue to have these conversations so that we can understand the barriers that our patients are experiencing that can impact their health conditions, and really talk more about what we can do to implement new strategies to help them overcome some of these barriers. Thank you.
Thank you so much. This has just been an absolutely wonderful event for us. And I will say that we had big ambitions of having a roundtable conversation after everybody presented. And I have about 50 questions, which I will not now try to squeeze into the time that we have remaining. So what I really want to do is there's a couple of things that I wanted to highlight that you spoke about, and I saw these themes of, transportation, education, what you were just talking about, income, food access. We are doing an Access to Justice event on Thursday. And I'm thinking that we are going to see a lot of these similar themes. And so I did have one question, and I know there's not a lot of time, but if there's one thing that if anybody wants to jump in, is what can we as individuals, so I don't work for a hospital system, I'm just little Kyla over here in Prince George's County, what is something that I can do that can work towards the equitization of health outcomes in these areas for all? Anybody?
Yeah, I think education, there's no question, education, not just in terms of longevity, but there is a direct correlation between literacy or literacy level and health status. I think, education, it's not going to cure every problem, but you asked for one, and I would say it's education. Okay. Access to information about health status. I think the physician who just spoke, was very articulate about access to healthy foods and food desert. It's education that really opens the portal to information. So that's if you were to ask one thing, that's what I would say.
Thank you.
I agree with Robert about the education. I think it's a good place to start. In case of Fort Washington, what we see is it's a community that could well afford the care, but because demographics look like they can't, despite the fact that they have probably some of the healthiest statistics to gain access to healthcare, talking about it like in a forum like this one, and talking more about it, having more conversations around that is going to be an important thing. Let's not accept as a fate that we must deal with, but something we can change so that we can collectively to change.
Thank you.
And I would just add, I would say advocacy, because I think the reason certain zip codes have unequal access is because of tax base and because of voice. As we're talking about zip codes, there people in those zip codes work at our hospitals, they teach in our schools. They serve in our cafeterias. But I think that sometimes, depending on your zip code, you don't always think your voice matters, or you don't even have the energy to raise your voice to say, hey, we deserve a Whole Foods too, or we deserve a Trader Joe's too, or we deserve access to fresh produce. You're hustling, working. Sometimes you're working multiple jobs because the wages are so unequal, and it's not a livable wage. So I think for those of us who have the luxury, the privilege to see this, or people like myself who've lived it, I advocate wherever I can to try to bring in a different perspective.
Thank you.
And if it's okay, I'd like to just piggyback on Dr. Leslie's stuff, which is really where we are today is a consequence of the policy decisions that we made 10, 20, 30 years ago.
Mm-hmm.
And so the policies that, look at it, a single mom who works at McDonald's, who has to go to a doctor, doesn't have a car, 2 hours each way. Those are not easy things to overcome. We may not live in those worlds, but those are realities for many. And so, again, if you look at those places where environmental conditions are not supportive of health, we can go back and see the history of disinvestment in those communities. So part of, when I say policies, really, again, just piggybacking on what Dr. Leslie said, to make sure that you reach out to your elected officials, decision makers, let them understand that it's what we call health in our policies, that they should make policies that are supportive of health.
Thank you. Thank you. I unfortunately, I do have to end this in the interest of time, which I don't want to do, but I think you will be hearing from me because we would love to have you all back. Before we go, I want to take a couple minutes to, first of all, thank each of you for being here, not only with us this evening and spending, an hour and a half of your night with us and your expertise and your knowledge, but what you are doing in our communities in Prince George's County, in Montgomery County, the state of Maryland, Washington, D.C. You are making huge impacts, and we are so grateful for you. I also really want to give a shout out to the library system. I mentioned at the beginning that they've been our event partners for many, many things. For those of you watching at home don't know is that we have a secret surprise backstage lifesaver. The acting co-CEO of the Prince George County Memorial Library System has been backstage with us tonight working on some tech things. Nick Brown, so thank you, Nick. And thank you all for tuning in and being with us. We do this for all of you around the region and the nation who tune in and join in with the Prince George's County Office of Human Rights. We have many, many more wonderful things coming up. We do invite you to check out what we have with pgcmls.info/events for the library. And you can come to our website, civilrights.mypgc.us. And again, thank you. And to our guests, thank you so very, very much. Good night, everybody.
Good night. Thank you.
Thank you.